cooking. I'm just making this one together thing, which is GERD and IBS. They're both stomach digestive things.
And they're pretty common, so most people know what they are.
What is IBS? It's a disorder in which abdominal pain is associated with a range of symptoms. So again, a syndrome is a group of common symptoms linked together. Who does it affect? 15% of the population, with 2/3 of that being women. Who treats this? Normally your primary care can treat this unless you're worse off, and then a gastroenterologist, your GI doctor. How's it diagnosed? Normally with this, it's diagnosed with the clinical diagnosis and making sure it's not something else. They'll do blood work to make sure it's not another cause, a colonoscopy to make sure it's not something else like Crohn's or ulcerative colitis, which is IBD. Normally there's 2 different criteria that doctors will follow. One of them is the Rome criteria. This criteria includes abdominal pain and discomfort lasting on average at least 1 day a week for at least 3 months. Associated with at least 2 of these factors: pain, discomfort, frequency of defecation, stool consistency is altered. So it's not a normal bowel movement pretty much. Or the Manning criteria, which is, this criteria focuses on pain relieved by passing stools and on having incomplete bowel movements, mucus in your stool, changes in stool consistency. The more symptoms you have, the greater likelihood you have IBS. So some of the symptoms are painful stomach, gas, irregularities in your stool, mucus in your stool. So for irregularities, that's diarrhea, constipation. There's 3 different types. So there's IBS-A, which they also call IBS-M, which is mixed between constipation and diarrhea. IBS-C, which is mostly constipation, and IBS-D, which is mostly diarrhea. What are the treatment options? Avoiding stress, low FODMAPs diet, increasing fiber to at least 35 grams a day, probiotics, laxatives. Normally they recommend a Miralax, which is an ostomic type. There are 4 types of laxatives. So the 4 types of laxative is a bulk forming, which is high in fiber, stimulant, and that acts on the bowel's nervous system to make it work faster. A stool softener, which just makes your stool softer so it's easier to go. Or an osmotic, which is bringing water into your bowels. Osmotic type is less addictive. There's also anti-diarrhea medications like Imodium. I'm not going to say this right. Anticholinergic medication, which helps reduce the bowel spasms and pain, like a medication called Bentyl. Antidepressants for stress management. Now the second part of this, part 2, this is GERD, which is also called acid reflux or gastroesophageal reflux disease. What is it? It's a digestive disorder in which stomach acid or bile irritates the food pipe lining. Your esophagus. It irritates your esophagus. It doesn't affect 20% of all people. So basically, if you're in a room and there's 5 people there, at least one of them is going to have this. Who treats this? If it's not severe, your primary care provider. If it is severe, your gastroenterologist, which is your GI doctor. How is it diagnosed? It is normally a clinical diagnosis, but they also do endoscopes, pH tests, which they call an ambulatory acid probe test, imaging, as well as a barium swallow. Barium swallows I do not recommend. No go. So I had one of those and I ended up throwing the barium up and didn't even finish. You know, it was like a 2-hour long test, but I didn't finish because I puked up and then they wanted me to do it again and I was not gonna do that again. Okay, what are the symptoms? Common symptoms include heartburn, difficulty swallowing, regurgitation of food or acid, and painful burps. You probably have acid reflux if you feel like you're like getting that little bit of throw up. Not pleasant feeling. Or that like bitter taste in your mouth. So, what are the treatments? There's antacids, so like Tums and Mylanta, An acid reducer, which is known as an H2 blocker, including Pepcid or ranitidine, Zantac. A protein pump inhibitor, which is a stronger acid blocker, like for example Protonix or Prilosec. A surgery, there's something called a fundoliptation, which basically they wrap part of your stomach around so that food can't get back up. Or a Lynx device surgery, which is basically they put a magnetic ring in there and it keeps it closed more tightly. Some of the risk factors include being overweight, having a connective tissue disorder, Ehlers-Danlos, pregnancy, delayed stomach emptying, gastroparesis, smoking, or large meals. If you have any questions, please feel free to comment below and subscribe if you're interested in what I'm making content-wise. Bye!